reason I chose spine surgery is I love the surgeries and the procedures, but it's really the social aspect, treating patients, teaching patients, being able to give them their function and their life back. That's really what caught me in the field, so to speak. Every patient's like a puzzle that we got to put together. Some people want to identify and fix a problem right away. Some people are scared and they want to do everything that they can to avoid surgery. My job is to be there on the journey with the patient and to be honest with them. The vast majority of patients that I treat don't have life-threatening issues or issues that they have to have surgery for. Many people get better with conservative management. So I owe it to my patients to outline all their options. And I'm fortunate to be a part of a group with 4 other orthopedic spine surgeons where we can aggregate our knowledge and experience to try to optimize outcomes for our individual patients. Over time, we've become more minimally invasive. I do a fair amount of robotic surgery, which wasn't even an option in the past. There's lots of different things that I enjoy outside of the operating room. I grew up playing hockey. I still play hockey. And I've got my son on the ice and he's 4 now, so it's a lifelong sport and I continue to play. I've treated thousands of patients over my career. That is the most important thing when I'm meeting somebody for the first time, is making sure that we're establishing that relationship so that over time we can make sure that we're all getting to the place the patient wants to get to. That's the most important thing about my job, is that connection.